like I alluded to, we can talk till we're blue in the face in terms of educating our patients, right? We can say, you know what, this is what we need to do. This is what you need to get your hemoglobin A1C in check. You need your albumin. You got to start taking better care of yourself, right? They have done studies and studies and studies with, right now in this study, 172 diabetic patients received the same amount of they received the same care, excuse me. There was no significant difference in ulceration incidence 6 months and at 12 months. They had the same education. There was no indication of quality of life was seen, and in terms of that. So education didn't really affect improved mood or quality of life. They received the same exact care. So sometimes, next slide, please, that we have to look at the fact that we are dealing with patients that they're sitting in a foreign environment, okay? They hear 80%, but they hear 100%, excuse me. They forget 80% of what their healthcare provider said, okay? So that leaves us 20% right off the get-go, okay? You're sitting there, and those providers in the audience, you know what we're talking about. They're looking at you, but the light's on, but nobody's home, right? Okay? So now they remember 20%. Of that 20% that they remember, only about 10% is even accurate, okay? So now we're dealing with that uphill climb with an ulceration. They don't understand what they're doing. And so I try to break it down as much as we can. What's easy enough, let's not get to that situation, okay? Let's get to the point where these patients empower themselves and take the ability to identify the ulceration, to avoid the ulceration, and take a more proactive stance in their health.